going to say everything you said. It's unbelievable. Well, it's great to talk to everybody here. I am a urologist in New York Presbyterian Hospital, and I deal with men's health issues. And you know, people always wonder, what are men's health issues? I just want to bring that up because why would you guys want to see a urologist? The truth is, when people come to my office, they leave, you know, with, you know, I don't even have a stethoscope. They leave with some sort of a cure, if you will, or a treatment that they could actually hold on to. Men's health is very simple. You know, men, three things I like to say: the bladder and the prostate. Are you getting up to urinate too much at night? Anybody? Nobody admits it. Oh, excellent. We all do at some point in our lives. We worry about getting up too much. Worry about prostate cancer, which is what I'm going to talk about. We worry about the penis, erectile function. Anybody have erectile dysfunction? Nobody. I wonder who's buying those Cialis and Viagra tablets. You know? And of course, the testicles, fertility, that's what I do, and testosterone. So testosterone has been in the news media quite a bit. So let's talk about prostate cancer. You know, I was greeted by Carrie Morstein, and when I said, like you said, geez, you know, prostate cancer is very similar to breast cancer. He goes, nah, what are you talking about? Breast cancer? That people, you know, more people die of breast cancer, more women do. That's absolutely wrong. In fact, can you hear me? The thing that I am literally not upset at breast cancer awareness, I'm jealous of breast cancer awareness. The statistics is kind of unbelievable. 1 in 6 men will get prostate cancer. 1 in 6, just like Ed said. Well, how many women get breast cancer? 1 in 7. Of the men that get prostate cancer, 1 in 6 will die of prostate cancer. 1 in 6 women will die of breast cancer who get breast cancer. And it's true, there are more men with prostate cancer than breast cancer. So why? It's unbelievable. And that's because of our apathy, if you will. We are more concerned with baseball than we are with our health. But you know, I like to say, if you bring your car in for a tune-up, how about making an appointment with your doctor, because we can help you with all these symptoms. Now, when it comes to prostate cancer, there's been a lot of controversy about how do you actually diagnose prostate cancer. Well, certainly, if your father or a brother or somebody in your family died of prostate cancer, you should go to a doctor in your 40s, 50s, and 60s, but at least in your 40s, because you have a higher chance of having prostate cancer. Also, if you're an African-American male, you have a higher risk of having aggressive. It's not so scary. Am I scaring you? You look at now, the thing about it is, you may have heard about the PSA test. It's a great blood test that detects prostate cancer. The only problem is it's not very specific, meaning you could have an elevated PSA level and not have prostate cancer, and then you're going to be poked and prodded and get biopsied, and geez, and 2 out of 3 times when you get biopsied, it's not going to show cancer. And that's a terrible thing, because the last thing you want is to get an unnecessary procedure. Well, it turns out with this test, this 4K score test, is a new test. It's a more sophisticated PSA test developed at Memorial Sloan Kettering Cancer Center. Thousands of people over years have been studied. It turns out that if you go to the doctor, you don't have to be worried. If you get an elevated PSA, this test will help you. It's so sophisticated, it helps you determine whether you need a biopsy or not. And that's a revolutionary thing. And that's where we're going towards, because our only test for detection of prostate cancer right now, the blood test, is the PSA. We're becoming much more sophisticated. But here's another thing. There's a lot of men who've had biopsies, and you may be one of them here, and it comes back without cancer, and the doctor keeps saying biopsy again and again and again. This test is specific for that, and hopefully will avoid the unnecessary biopsies. I just want to end with one more thing in terms of the severity of prostate cancer. I don't want to be a downer about it, but it's important. There's about 2.8 million women who have had breast cancer and survived breast cancer or alive with breast cancer. There's about 3 million men that have prostate cancer and have survived prostate cancer. So it's a real deal. It's something, like Ed said, if we detect it early, don't be afraid to go to the doctor. It's not that complicated of a thing. We're not that scary. I don't think I'm that scary. But thank you for listening, and good luck.
So we'd like to think that Ed Randall's Fans for the Cure is making a difference. I'm just a guy who started a charity because I wanted to make a difference in people's lives. And by making doctors and patients aware of a test that spares men the agony and the anxiety of multiple biopsies, We believe we're making a huge difference. One doctor spared 15 men of biopsy needles and possible complications thereafter. The bottom line for us, no empty chairs on Thanksgiving, no empty chairs on Hanukkah, no empty chairs on Christmas. There will be many more events like this one that I hope you'll support. We ask you to please follow us at fansforthecure.org using the numeral 4, and on our Facebook pages. You can easily donate on our new site. $5, $10 a month will help us to continue our medical and educational programs, including in the minor leagues, as well as our free screenings. Donate $35 for a screening for somebody, or $1 a day at fansforthecure.org using the numeral 4. Our second annual gala on September 26th will be one of the upcoming events, as well as concerts, educational seminars, and other medical educational programs like this one. Please help us to continue to make a difference.